Hello, it's Jason again with Alternative Mobile Services Association, AMSA Talks, and today we're with Dr. Theresa Nguyen of Loyola Street Medicine. Hello, Dr. Theresa.
Hi, Jason. So glad to be here today.
Well, we really want to learn more about Loyola Street Medicine, about how you got involved with it, and a little bit about Chicago too. Start by telling us about the some of the demographics. What are the bullet points for Loyola Street Medicine?
Yeah, for sure. And actually, the timing of this is perfect because we are actually celebrating our 5-year anniversary this month. We were officially established in January of 2020. And when you think about what was going on that year, we could not have predicted a better time and a place to start a program like this.
Mm.
Um, and it's been really amazing to look back and see how much we've evolved in the last 5 years. You know, we started out as really like a small group of dedicated volunteers, staff, and students that were really passionate about serving our local homeless population and trying to meet their needs in a compassionate and caring manner. And over the years, we've been able to expand our outreach. We've now established an inpatient consult service in the hospital. We can certainly talk more about that later on in the session too. And, you know, we have a growing group of volunteers and education, and really been able to connect with our other street medicine chapters in the Chicagoland area, as well as participating in street medicine symposiums with other street medicine chapters globally and nationally.
Fascinating. And how many you say volunteers? Tell us how this works. How do you get volunteers to do this work?
Yeah, so I'll backtrack a little bit and I'll tell you about our the different outreach that we do just to kind of get a sense of what kind of staffing and volunteers and time commitments we need. But we engage in a number of different outreach opportunities throughout the week on a fairly consistent basis. So on Monday evenings, we actually assist one of our community partners, Housing Forward, um, with a clinic that they actually do at their interim housing site. And so Housing Forward actually has a community nurse on site, and we usually have about 2 or 3 volunteers that help with the clinic. And usually anybody in that interim housing site will come by with medical questions, or maybe they just were discharged from the hospital and they were unclear about certain things. And so we help them work through some of those questions and those issues, review labs, review results. Some come just for weight checks to make sure they're staying on track. And so it's a number of different needs and varieties. And so also as an extension of that Monday evening clinic, we'll often do some specialty clinics. So maybe we'll have an ENT team come and they'll do ear cleanings, or they'll do exams and counseling for patients. We'll also have podiatrists come. As you can imagine, foot care is a big need amongst this population, and oftentimes we'll also have vaccination clinics too that we assist with there. So that's specifically with Housing Forward and their interim housing site. In addition, like the key outreach that we do, where we actually reach a larger portion of the population, is our outreach on Thursday evenings at the CTA Forest Park Blue Line station. And so the CTA is our Chicago Transit Authority. It's our main subway line. And we actually set up a makeshift clinic at one of the train stations there, in addition to having other community partners on site. So the night ministry is one, and Shower Up Chicago is another community partner that comes. And so we provide pretty comprehensive services on Thursday evenings from 8 p.m. to midnight. Our team as Loyola Street Medicine will provide medical outreach, whereas the night ministry will provide food, clothing, harm reduction supplies, as well as a social worker. And then Shower Up Chicago will provide a free mobile unit too for patients. And what's nice is we all work so collaboratively together. It's like I said, it's pretty comprehensive services that are being offered at this station. We probably engage with anywhere from, on the medical side, probably maybe 15 to 25 patients on a given night. But in total, there's easily 100 to 150, sometimes even more people coming through the train station on a Thursday night.
And so you're really built into this service ecology, the already existing agency.
Yes, for sure. And then, sorry, I forgot to mention that on Friday mornings, we do another local outreach in Maywood with Housing Forward, as well as Live for Lolly, which is a harm reduction organization. And that's really trying to bridge the gaps in care for patients suffering from both housing insecurity, homelessness, substance use disorder, and then, any sort of medical needs.
And you're providing straight up medical care. You're not just providing some navigation services or granola bar and a bottle of water.
Yeah, that's correct. I mean, we're dispensing medications, we're performing physical exams. We actually chart all of our patient encounters into an electronic medical record, just as you would in any clinic. It just so happens that our clinic is at a train station.
Now, I see that you have this logo behind you, Loyola University. Tell us about the relationship between Loyola Street Medicine and the university.
Yeah, so I've been so grateful to have the support of Loyola University of Chicago, which owns our medical school, as well as Loyola University Medical Center. And so, we've been able to bridge the gaps in terms of being able to have support from the medical school side, where we can have student volunteers and faculty and staff participate in these outreach activities, as well as building a curriculum into the education there. And then from the hospital side, getting a lot of support with starting our inpatient consult service. So we actually started our Loyola Street Medicine inpatient consult service in March of 2023 as a means of really trying to engage with patients and primary care teams while they're in the hospital. I mean, you think about how hard it is to be in a hospital to begin with, right? And let alone if you don't necessarily have the health literacy or the understanding or even somebody to advocate for you during that time. A lot of things can get miscommunicated, a lot of, potential bad outcomes can happen. And, so one of the primary goals of our inpatient consult that they understand what's going on with their healthcare, and then also connect with the primary care teams in terms of making sure that they understand the psychosocial circumstances that this patient might be going through, right? And so we're making sure that everybody's needs are being met, and that we also try to work through safe discharge planning, coordination of care, and really trying to make sure that the patient's needs are being met in a meaningful way.
And are these physicians persons looking at a career in public health or in public hospital work?
So for our students, are you talking about for our medical students specifically?
Yeah.
Yeah. So I actually wear a separate hat at our medical school here, where I actually direct our Center for Community and Global Health. And so our Center for Community and Global Health actually runs one of the 3 honors programs that's offered to medical students, where it's really centered around a social justice, health equity mission and working with underserved populations. And so these students that participate in our honors program are really passionate about working with underserved populations in their careers, whatever specialties they may end up in. And so this gives them an opportunity to be better engaged with community and learn some of those fundamental principles of working with these populations.
Yeah, this is exceptional field opportunity. These are things you do not learn in the classroom.
Yeah, and I actually often like to refer to street medicine as a clinical classroom without walls, right? You're not going to get this information in the textbooks. You can learn all you want about, frostbite and infections and things like that. And then when you actually see it and see people living through it and hearing their stories, that's probably the best education that you can get.
Tell us a little bit about this social justice mission. How does that get things framed and started and going in the right direction?
Yeah, so that social justice mission actually goes back to, being at a Jesuit institution, where the mission and the motto here is very much service for others, that cure personas, cure personalities. And I think a good majority of our faculty or staff here really much embody that mission and that sense of kind of social justice and social responsibility. And so I think that's made it a lot easier in a sense to be able to garner support, to garner volunteers, to really get people engaged and motivated to be a part of this movement.
And Loyola is not the only street medicine program in Chicago. Can you tell us about the others?
Yeah, that's correct. So we are actually technically a chapter within Chicago Street Medicine, which is the umbrella nonprofit chapter. And so within Chicago Street Medicine, there are several other university affiliated street medicine chapters, including University of Chicago, Northwestern, as well as University of Illinois, Chicago. And there's a few other, like Rush is technically not part of Chicago Street Medicine, but they also have another university affiliated street medicine chapter that we also work very closely with. And so what's nice is even though we are all in, Chicago's big, as you know, and all of our healthcare systems are kind of scattered throughout different areas of the city. And what's nice is that even though each chapter kind of has their own overall different catchment area, there's still often overlap between patients. The overarching goal and mission, and circling back to that social justice mission, right, is the same, right? We're all really trying to serve this population that's been often marginalized, often stigmatized. And so, we come together in terms of sharing of ideas and education and research and really trying to work together to serve this population.
You mentioned earlier your EHR system and overlapping. You probably often see patients who already have a provider somewhere. Are you communicating with them?
So that's, it depends. So if they're affiliated with the Loyola system, it's a little bit easier for me to integrate that care. Sometimes if I am able to set up an appointment with their provider at Loyola, or if maybe they've seen a specialist here and they might have missed an appointment for whatever reason, that's something that I can relay to the team. It's a little bit harder because we don't have a perfect EMR system here in that while I do have access to some records, I don't have access to all, nor is there an easy way to communicate with some of those providers. But that would be certainly something that I would love to expand on in the future.
Yeah, that's a dream of every medical person in the future, is an EHR system that actually works for us all. But tell us a little bit about how you got involved in it. There's a social justice mission of the school. What's your social justice mission?
Yeah, so I've had kind of a long-winded journey to get here, but so I'm an emergency medicine physician by training. And actually in the early part of my career, I was actually very much involved in global health. So global health in the sense that, I was involved in providing care internationally, right? So I would do a number of medical mission trips. I was also involved in teaching emergency medicine as it was an evolving specialty in certain countries. So like I had been teaching in Vietnam, teaching in Haiti, and
Oh,
was in all of my travels internationally was really always kind of struck by the fact that, these inequities exist very much in our backyard, right? And you don't have to hop on a plane and get a passport stamp to see health inequities, to see underserved populations, to see people suffering. And as an emergency medicine physician as well, and especially in the last decade or so, those health inequities have become even more prevalent, right? When you think about the fact that uninsured patients have nowhere else to turn, and our migrant population, and so many people that are struggling with some facet of health inequity or a social determinant of health, that oftentimes the ED is where they turn to. And I see this even now, right? So it's single digits here in Chicago right now. We've definitely seen an influx of frostbite injuries related to individuals experiencing homelessness. We've seen an influx of mental health crises. We've seen an influx of so many different emergencies and pathologies that I think are so important to try to address. And so, this is kind of how I shifted my focus a little bit now more locally. And so I was, really trying to think through what is a way that we can meaningfully drive some sort of change and still be able to impact a population, and also, educate our fellow providers to better understand this population. And so that's actually how I got more involved in street medicine.
what an excellent mission. Thanks for all the good work you do.
Thank you.
Thank you so much for visiting with AMSA Talk.
Appreciate it.